Welcome everyone to a beautiful Thursday evening. Welcome to Sukoon Unlimited. I hand over the stage to Dr. Steve, and he will talk about the essentials of healthy aging and what are some of the things that we should remember for us to age happier and healthier. Right? Without further ado, let's begin by understanding what is Sukoon Unlimited. This webinar is hosted by Sukoon Unlimited in association with Apollo Hospitals, and Dr. Steve is associated with Apollo Hospitals. Sukoon Unlimited has only one single mission, which is to make our seniors feel happy. Right. Give me 1 second and okay. So Sukoon literally means peace in English, and that's all we want as a company. We have only one objective, which is to make all of you feel more at peace, comfort, and joy every single day. We want all of us to feel that we are part of something larger, we are connected, we are not alone. And whenever there is a need for any emotional or practical support, it is always available at your fingertips, no questions asked. We are headquartered out of Bangalore, but this is a digital platform, so the services are available across India. On Sukoon Unlimited, there are two types of services that we offer. One is in the space of emotional support, and second is in the space of practical support. In the space of emotional support, we are creating a community of empowered seniors who are genuinely care and watch out for each other, and they step up to help the community wherever anybody is in need. The community is always available to talk, to offer advice, to become friends, to offer companionship whenever needed. On the practical side of things, we have tied up with the best of industry experts in three areas: financial investments, law, and mental health. And all these three areas are accessible to any senior citizen across India on their fingertips through the entire week. In addition to this, we conduct weekly workshops by leading health experts like one that you're attending today. On Sukoon Unlimited, the community is 100% safe. All conversations that are done within the community are 100% confidential. Support is available 24/7 every day of the week, and the platform supports conversations in more than 10 languages across India. In a nutshell, what we do is we offer four services. One is a community of Sukoon Sathis with whom you can pick up a phone and talk about anything that is on your mind, no questions asked. Sathis are also seniors who are volunteering their time to be available for other seniors. Then we have Sukoon experts. Sukoon experts are retirees in the space of finance and law. They have over 30 years of experience in each of these industry, and again they're available for any discussion and soundboarding. We also have certified counselors and psychologists on Sukoon who are available for both one-on-one consultation and group counseling. And lastly, we conduct over 20 community events and workshops in a month where any senior can come to either learn something new or enjoy themselves. Our contact details are mentioned in the slide. It's also going to be shared with you. And for any queries on Sukoon Unlimited, you can reach out to the team. Coming to today's session is a it's a very special session for all of us. We have Dr. Steve from Apollo Hospital who is here to tell us about how to take care of ourselves better, especially as we age. And is in this session, he is supported by Sarthi Anubha. Sarthi Anubha is part of the Sarthi ecosystem on Sukoon Unlimited. She's also a certified counselor, and any person wanting to talk to her can come and talk to her on Sukoon. Dr. Steve, welcome to the session. Sarthi Anubha, over to you.
Thank you so much, Vibha, for creating such a wonderful platform for us who are seniors and inviting Dr. Steve, who is an expert in the field. So I welcome Dr. Steve on behalf of all of us who are present, and I would like to ask some questions which, give us some worry. So my first question is, Dr. Steve, what are the most common misconceptions about aging that you encounter?
Okay, so most of them, not so much in the older population, but the children rather, are of the assumption that as you become older, your faculties will become slower, you will have memory loss, you will be slow, and it is normal to fall once in a while. So these are misconceptions which, if not addressed, can lead to a poor quality of life. So we have had patients who come with dementia or profound memory loss. But when you ask, these symptoms began a couple of years ago. They ignored the initial symptoms, assuming this due to be age related. So that's one of the commonest misconceptions we find.
Okay, okay. Thank you, doctor. So children actually consider us that we are becoming old, we are seniors, but actually it may not be the fact. So what, doctor, we can do, how we can recognize the early signs of cognitive issues, and what steps we can take to take care of our health?
So the best judge of a failing memory is often the patient himself. The patient himself knows I'm not as sharp as before, but they often fail to communicate this to their loved ones or for a fear of being stigmatized. They fear that if they mention about the memory loss, they are going to be labeled as having a problem with the memory and becoming too old. So they try and hush it up. It is important that children who note this talk to them about the same issue, because if you look at the progression of dementia or cognitive health, they are six stages. Stage one is mildly forgetful, but the patient is able to know. It's often in stage three that the family is aware that there is a problem, before which the patient himself would be now sure there is a problem, but I will try and hide it as much as possible. If your parent or your loved one does not bring it out, it's important that the children who note this or whoever is living with the patient, if they note this, they need to bring it up and seriously sit and discuss. Is there a problem you find with your memory? We've noticed that there is a problem with your memory. What do you think about it? And initiate the conversation and bring it to the attention of a doctor, because not all memory loss is dementia. There are ways to correct and treat them. It's important to bring it up. That's how we realize. And not all cognitive issues are related to memory. It may be related to mood, decreased speak. They suddenly start to not speak as much as they used to, or change in their behavior. These are also signs of poor cognitive health.
Okay, okay. Thank you, doctor. So what do I understand? Memory loss and then moods. So a lot of senior citizens are right now present and they may be aware that from which stage of memory or mood they are going through. And we will give the opportunity to all of them to raise the questions. They can raise the questions through the chat box, which we will address later on. But just to understand this aging process, I will request Dr. Steve to answer what specific foods or vitamins can be good for our health. If you can just throw some light on that.
So, in general, we Indians tend to consume a lot of carbohydrates in our diet, and that includes calories as well. So if you look by the Mediterranean diet, the Western diet, there's a lot of omega-3 fatty acids. These are products or compounds that have certain actions by which cell damage can be prevented. These are largely present in vegetables and fruits, especially fruits, um, and some vegetables. But more importantly than fruits and vegetables, you need to focus on what's good for your health, because all of them do not age the same way. Some have diabetes, some have hypertension, some have high cholesterol. The the root point here is that avoid consuming too many calories. That's the one most important takeaway. And avoid fatty acids in all forms. By fatty acids are high cholesterol containing foods. These are a universal no. In particular conditions like kidney disease and heart diseases, you may have to cut down your oils as well. So, and as if you notice that you're losing your body weight, it may be helpful to consume more protein in your diet. But this comes with a caveat. You should rule out the presence of diseases such as kidney diseases where there is a lot of protein loss. Because in these diseases, if you consume protein, that may not be good for your health too. It may affect your kidneys adversely.
Okay, so doctor, this is about our food and cognitive health. I would like to know from you, what can be done for our emotional well-being? What are the best practices which we senior can adopt for our emotional well-being?
The biggest pandemic after COVID or during COVID that surfaced is loneliness. That's the biggest problem here, especially in metro cities. Most of them are, even at their homes, they tend to be lonely because the pace or the fast-paced life of metros is such that children go to work and come home late in the night only with enough of time to sleep and get up again. So, so being busy, extremely busy, puts the older person at home lonely, alone. So it's important to maintain your own social group. So I keep telling my patients, do not expect your children to be there with you or to give you the company you need. You have to build your own network, for which the first thing is to step out of the house. Most of them are content staying inside the house. So it's important, especially so if you're living in a society, you need to step out, meet other people, develop a network. It may be one person or it may be two people. The three people sitting together and talking about day-to-day events will enlarge and become a bigger group. It is important to share your differences, share the problems at home. So when you share your problems, it not only becomes lighter, you also realize there are others facing similar problems. So there's no one who has no problems, but maintaining a regular routine, finding a reason to get out of the house, taking a small walk, these go a long way. So building a social network is one important thing. Second, um, you need to do your mental exercises too. It is important to you need to give your mind equal amount of rest. Not all conversation is comfortable. Some when you meet certain people, you would know there are some who speak about ill matters. If it affects you, please avoid. I have a patient who gets disturbed by when others speak about their ill health issues. So avoid such situations, because if you know that's going to hurt you, avoid that crowd or avoid at that point. So, and along with this, mental exercises, which can include yoga, meditation, prayer, whichever way you call, even sitting and reading a book in the quiet corner will give you the mental relaxation you need. Some enjoy music, something to keep you busy. You need to have a timetable. You need to have an itinerary to follow every day. These will improve your mental and social skills too.
Okay, okay. Thank you, doctor. So what do I take it from you? Connecting with people is good in this age, like to fight with loneliness. And
Exactly.
we at this platform are trying to do that only. We can connect with each other virtually. So I am sure that we can take care of our emotional part. Doctor, before I proceed further, one of our participant has asked, one boiled egg a day. Is that okay for 75 plus age? One boiled egg per day. Is it okay?
Definitely. But you need to watch your cholesterol if you're going to take the egg yolk as well.
Yeah.
But again, if you have a kidney disease, a lot of protein may not be a good thing. So if your total protein intake is just limited to one egg, then it's fine. But your food may also include other protein containing foods. So you need to be watchful if you have got a kidney disease. Otherwise, that's fine.
Okay. So, in short, I am taking it from you, कि doctor, we should be very careful about our calories intake, right?
Correct.
We should focus more on vitamins, what we are getting from fruits and vegetables. There should not be excess of anything, right?
Right.
So we
And
should
avoid
take,
a lot of salt. Processed
yeah,
foods, the ones that come in cans and packets, most of
right,
them contain excess of salt and other ingredients which are not good for the body.
right, right. And here, one participant has suggested for emotional well-being that doing some online courses, learning a new language, listening to music, all these are also good.
Right.
So, doctor, now tell us how important it is to go for periodical health checkups.
Yeah, that's a very important question. And I strongly recommend periodic health checkups because not all diseases surface to a level where you detect it by an examination. See, for any disease to be manifest for the patient itself, it will take a couple of years. It could be a small problem in the kidney or in the heart. The symptoms of a heart failure or a weak heart are tiredness. So, if every tired person were to assume that I've got a heart problem, that would be overthinking, right? So, but if you go for a periodic health checkup, you can detect these problems much before they become clinically apparent. Now, many are afraid of going to the hospital, not only because they do not like hospital surroundings and they fear an infection being transmitted to them, they are also scared of being diagnosed to have some illness and being subjected to a surgery or any intervention. Now, one thing you need to realize is you can always get yourself diagnosed, but what treatment you need is entirely up to you. The doctor may find the ultrasound abdomen scan that is done may reveal a stone in the gallbladder. It is not producing any symptoms. One doctor may suggest a surgery. You need not immediately agree to the surgery. You can always take a second opinion and ask him questions. So even today, we had just before joining this conference, I was on a call where an elderly lady was detected to have a growth in the jaw. So she has a mild dementia and she is fairly able to walk and manage. She's 83. So what I spoke to the family was you need to ask four questions. What are the benefits of the surgery? What are the risks of the surgery? What is the alternative? Do we have an alternative besides a major surgery? And what if I don't do anything? This four questions called BRAN, BRAN. Always ask, what if I don't do? Always explore your options. This is still better because there are always alternatives. This is still better than not subjecting to a medical checkup because only when you do a medical checkup, these problems are detected. It helps the doctor foresee and helps you also to plan. This is the way things are. In the next couple of years, this is likely to happen. So it helps the patient, helps the caregivers to decide on how to plan things ahead.
Okay. How frequently, doctor, it is advisable to go for health checkup?
If all is well, see, for a 40-year-old, we advise health blood checkups every year, once a year.
Mhm.
For an older person, it can be 6 months to 1 year because depending on your initial health checkup, if problems surface, then the doctor would recommend doing some checkups that are important. Not all the corporate health checkups are useful. It may be wiser to go to a doctor and ask what are the checkups that I need to do. There are many that the corporate health package offers. What is the bare minimum I need to do? If the doctor writes down a bare minimum and you find that is being covered in one of the health packages, go for it. But often you may find the need for a couple of tests which are not covered in the health package. So you should not assume that I've done my health package, all is well. Okay.
Okay. So, doctor, now I would like to open this platform for the participants for some time. If anybody is having any doubt regarding health checkups or maybe about food habits, so forum is open. Participants can ask directly. This is the wonderful opportunity that we have doctor with us. If any specific thing you want to know about your food or health checkup.
Can I speak, please?
Yes, yes.
Just wanted to know, I have asked in writing. I am a diabetic patient of 31 years. Do I need to have every 3 months a checkup? I am doing it at the moment for last 1 or 2 years. Is it advisable to go for every 3 months?
So for a diabetic, only for the diabetes, checking
Yeah.
your A1C level every
Uh,
3 months is advisable.
yeah.
But if
Yeah.
your A1C levels are fairly okay for the past 3, 4 sessions, let's say 2 or 3 sessions, your 3 monthly checkups have been normal, you can
Uh,
probably push it for another 6 months later.
okay.
But that's only for diabetes. With diabetes comes kidney disease,
Yeah.
neuropathy, eye problem. So
Yeah.
you need
So
to have
eye checkup
yearly
I
check.
have once a year, and for my creatinine level has been around between 1 to 1.3 for last I would say about 15, 16 years. So I also get every 3 months checked the creatinine level.
Fair enough. That's fine. So that's not too frequent too, because creatine kidney disease can slowly start to rise, and you would not know. Initially, there aren't any symptoms. So it is
Okay.
3 months is not too soon and
Uh,
neither too far. It's fine.
okay. Yeah, this everyone above the age of 60 have lots of bloating. Most of the people have it. You have any solution for that?
Again, bloating is not normal. It
Yeah.
often may be due to one of the tablets or medications you're taking, or due
Okay.
to a physiological change in your systems, or due to the food intake. Many
Yeah.
factors need to be considered. So
Yeah.
it's not normal because of aging that you'll have bloating sensation. That needs evaluation.
Okay. Okay. Thank you. Thank you.
Any other query from any participant? Someone has written how to control cholesterol level. Doctor,
Daily
how
walk.
can we control?
Um, some patients produce a lot of cholesterol in their body. Some foods generate a lot of cholesterol in the body. So the best, easiest task is to go for a regular brisk walking, about 30 minutes a day or 150 minutes a week. So 5 days a week of 30 minutes of walking is fine, or lesser than that, but so that you maintain 150 minutes of brisk walking, not lazily walking with the phone in your arm. That's not walking. You need to walk briskly. So this brisk walking will help reduce your cholesterol levels to an extent. To what extent it will reduce, you will only know when you do a blood test. So just walking doesn't assure that your cholesterol levels will be low. Because as I said earlier, some people produce a lot more cholesterol. So it's important to keep checking to see if that is enough, or the statin doses you're taking need to be upped. All those regular checkups need to be done.
Just do, I mean, doing the 20 minutes treadmill, about 25, 26 minutes of cross trainer and a slight weights exercise is for 1.5 hour maximum. Is it good for above 60 years old?
Again, age does not determine. When I worked in Australia, I have come across 75-year-olds lifting more than 10 kg weight. So
Okay.
age does not determine it. What determines is your frailty state, or your how old your organs are. If you do not have major diseases and you are fairly fit and healthy,
Mm,
resistance exercises
yeah.
are lifting weights. they are good. They maintain your muscle mass, because walking and other aerobic exercises will not maintain muscle mass. But they will maintain your blood circulation well. They will maintain your heart aerobic exercises well. But for maintaining muscle mass, to prevent muscle mass, you need to do resistance exercises. But starting resistance exercises at the age of 75 can be a little tricky, because you may have lost a lot of muscle and your other organs may be old or weak. So you need to be careful and check with your doctor whether
Okay.
you're allowed to do them.
Okay.
Doctor, we have one question. Is there any person who wants to ask?
Yes, may I ask?
Yes,
you?
Geeta ji.
I have sent in the chat.
Okay, can I talk?
Yes, you can talk.
No, I just wanted to ask that once one has got stents put in and then one is on medication. Now, the cholesterol medicine obviously controls your cholesterol, but with the exercises and all, do these medicines have to be taken lifelong, even though otherwise there are no other complaints?
Yeah,
How
so
long
this is a very important question. And I want everybody to listen this very well. So many are of the assumption that my cholesterol levels are fine and I have no problem now. Is it okay to stop medicines? Once you're diagnosed to have a heart condition, and particularly if you have a stent in place, the body attracts, or the stent attracts, cholesterol and other debris in the fluid, the dirt material in the blood, which goes and attracts to the stent, potentially blocking the stent. The stent, suppose your vessel is this diameter, the stent is kept to keep it open, but with particles lodging in the circumference of this, it becomes narrower. So such a patient, if he stops taking the tablets like aspirin and statins, this shuts. So when it shuts, you have an attack. So I've come across some patients who thought similarly and decided to stop medicines. That's very crucial and very risky. Even a patient, if a patient with a stent has to undergo a tooth procedure, in some cases we advise not to stop the aspirin, because stopping the aspirin and going for the tooth procedure, although will decrease the risk of bleeding, it increases the risk of another attack. So it's important that it's particularly so if you have been diagnosed to have a heart disease, you need to take your medicines for life. That is the only indication where antiplatelets and statins are recommended for life. Earlier, the practice was if you are a diabetic, you could take. That's not recommended anymore.
I had a dental surgery, but I was asked to stop for a few days, but then resume again. The blood thinners, but then I suppose
So if you have a stent in place and you are on an antiplatelet, but you still have to undergo a major surgery, the risk of the bleeding from the tablet, especially if it's a major abdominal surgery, is much higher than the risk of another clot developing in your heart, which is why they ask you to stop it temporarily for generally about 5 days and restart as soon as the surgery is over.
yes, that's what they did. Thank you.
Doctor, what are some medication pitfalls? One participant has written that there is a lot of opinion that the pharma industry is needlessly promoting cholesterol drugs. And nowadays, people sometimes they are slightly apprehensive that doctors are prescribing sometimes overdoses. And for blood pressure and cholesterol, once they start taking the medicine, they have to continue. So a lot of things are there. So would you like to throw some light on how we seniors can take care of our medicines? How many medicines are very, very crucial, important?
Let me answer this question two ways. Cholesterol levels earlier were suggested to be kept less than 150. The bad cholesterol, I'm talking about LDL cholesterol. Earlier, the numbers were 150. Now it's come down to 130. a patient with diabetes and already known to have a heart disease, it should be kept less than 70 or even less than 50 according to some latest studies. But less than 100 is fair. Less than 100 is fair for LDL. I'm talking only about LDL cholesterol in patients with diabetes. In a non-diabetic patient, up to 110 to 130 is fine. Okay. Irrespective of the second part of the question, irrespective of whether you take medicines or only lifestyle changes, if you are able to manage your blood pressure and if you are able to manage your cholesterol, that is good. Nobody likes to take right medicines. Whatever you do, if you're able to bring down your cholesterol, your blood pressure, and your sugars well within the reasonable range, that's fine. So this is a common misconception. If I start taking medicines, I cannot stop them. The problem is not about starting to take medicine. The problem is about having higher levels. So whatever you do, bring your levels down, good. If you lose your weight, you may be able to bring your blood pressure down. If you go for a regular walk, you may be able to reduce your tablets or even insulin requirements. So it's all about lifestyle. If you have consumed one and even bananas, especially ripe yellow bananas, the smaller ones too, even yellow, they are rich in sugars. So even if you take a small piece of mango, that is more than equivalent to one whole of apple. So these are the considerations you have to keep in mind when you take fruits. And if you do consume a high glycemic index fruit, don't check your sugars the next day. That's what people do. They check their sugars the next day and come, my sugars are high.
And doctor, she's asking one more thing, how reliable the devices are for checking the blood sugar?
So each blood glucose monitoring device is not accurate. However, they are about 10% variation. But in order to know where your levels of sugars are, that's okay. So I do not insist my patients to undergo a lab test, because whether it is 180 or 200, I have my answer. It is above normal. So only when you need to diagnose a patient with diabetes, a lab test will be more accurate. But otherwise, this is fairly enough. So on a day-to-day basis, it is enough to check on the glucometer.
Okay, okay. So doctor, now we come to the most important thing, which is sound sleep for our health. And it is, very, very important, we all know, but sometimes we struggle. So I will request participants, if anybody has any query related with sleep, they can unmute themselves and ask doctor directly, because sleep is also very important.
Yes, madam.
Can I ask a question?
Yes.
Shamla here. Am I
Yes.
audible?
Yes, you are audible now.
Yeah, when I sleep, I have severe body pain. When I'm awake, it is not there.
So when you're sleeping without moving, a body pain is not expected. Is it when you're moving during sleep? If you have body pain, that indicates there is a problem in your muscles or bones, which needs evaluation again. Sleep will not cause body pain. There's something that needs to be evaluated.
He's calling it as fibromyalgia, whatever that means. Some body pain, he's diagnosed it as that. And some antidepressants he has given to me because of this. I don't know how right it is. Should I take another opinion?
Always take a second opinion, even if I'm your doctor. Always take a second opinion. Why? Because fibromyalgia is very common in older people, especially so if you have anxiety and depression. But it should not happen only during sleep. Such a situation would be present all the time. So
No, it's only during sleep. It's only during sleep.
it's always good to take a second opinion. There's nothing wrong in it.
Okay. Thank you.
So doctor, if you can suggest some strategies which can help improving our sleep quality? And especially for the senior citizens who are experiencing some issues with sleep or experiencing insomnia.
Yeah, so whenever people come, whenever there are questions about sleep or not getting a good sleep, you need to ask yourself a few questions. Are you maintaining a proper sleep hygiene? Sleep hygiene is, there are a couple of things in sleep hygiene. One, avoid daytime sleepiness. Number one, avoid daytime sleep, avoid daytime naps. If at all you have to take a daytime nap, it has to be in the afternoon, post lunch. Half an hour is fine. Many people claim they don't sleep in the daytime, they just lie down. But when you lie down, you have micro sleeps. These micro sleeps impair the quality of your sleep in the night. So, as far as possible, avoid daytime naps. Number two, get up and go to the bed at the same time every day. If you maintain a regular time for the bed, your body automatically adjusts to the time and you get a good sleep. Bed is only for sleeping. Bed is not for looking at WhatsApp videos, lying down and looking at WhatsApp videos and looking at Instagram videos. There are a couple of people who do that all the time and claim they don't get sleep. So some even go to the extent of playing video games. That's all the strict no, because when you watch videos and screens, they're all stimuli to your eyes and your brain. Even if you shut the mobile off immediately, these continue to run in your mind and unknowingly, this can affect your quality of your sleep. So avoid TV, to avoid any screens at least 2 hours before going to bed. Avoid taking a heavy meal before going to sleep. Again, 1.5 to 2 hours before going to sleep, avoid a heavy meal. Then a little of physical activity every day can give you some of the exhaustion you require to have a good rest and sleep. Somebody has written a message now, I get up 2 to 3 times for urination. So interrupted sleep is often due to urinary problems, nightmares sometimes, some medications themselves. So if you have a urinary problem, see the doctor and see what can be done about it, because that will affect your sleep quality.
Thank you, doctor, for giving us so beautiful, insights on sleep. Now, I would like to know two things. One is some chronic pain. Some pains are there in body after, 50. And then we are advised or we are taking some medicines. So we are interested to know when we should take medicines and what are the side effects of the medicines, and then how to avoid the pains also, some chronic pains.
Okay, so yeah, so we need to have a diagnosis of that chronic pain. Is the chronic pain due to a muscle disease? Is it due to a condition? Is it due to some osteoporosis? Or these need to be addressed. So those are things that we need to sort out first.
Thank you, doctor, for this insight that pain is not age-related, which usually we assume. So my last questions will be, doctor, how we as a senior and our family members can prepare for any unexpected health issue or emergencies.
Okay.
Anuva, just a minute.
Yeah.
Before we go to this second question that you put, I will be back on the first question that you asked on this body pain. Doctor, one morning when I got up, I had a severe pain on my right, arm disc. I kept it just like this for a couple of days, thinking that maybe because of the weight load that it would have happened. It did not settle. Then I went to orthopedic. The orthopedic suggested that it could have been because of some multivitamins deficiency. It is nothing to take with the orthopedic regions of any bones or degeneration of bones. He gave me a medicines of some anti-inflammatory things and then some multivitamins. Did not settle even for a month. Now he says I will have to go in for an injection which is based on that is, he calls it, which has got heavy metals, steroids. Steroids based injection he wants to put. I didn't go for it, and I'm going for now Ayurvedic treatment. It is giving me little relief on that part of it with Ayurvedic medicines, which is basically, some oil treatment on the back, and then some massages. It is giving me relief. But am I on to the right track? Because the pain is shifting now from there to somewhere else.
Dr. Steve, you have to unmute yourself.
I'm not able to hear Anubhav.
Am I audible now?
Yes,
Yeah,
yes.
you are.
Yeah. Where exactly was the pain? Was it on your back or generally whole body pain?
See the periphery of the shoulder disc, which is a sort of a curve, no?
Okay, okay. So sometimes what happens is the muscles and the ligaments around them can either due to the ligament calcification or due to a degeneration of the bone can cause compression of the shoulder there, and which can only be controlled by relieving the tension there, which is possible through a steroid injection, which is not a lifelong therapy, which is a temporary measure to relieve the swelling or the inflammation there. Only for that purpose, a steroid would have been advised. If Ayurvedic or any alternative therapies give you relief, it's fine. But one must keep in mind that native medications are notoriously known to cause kidney disease and liver disease. So you need to keep checking if all is well and check with your general medicine physician if it's okay to take these medicines.
No, they don't give medicine, they give therapy. They give therapy. They don't
That's fine.
give any medicine that is consumable.
That's fine. All those are okay. And if that gives you sufficient relief, then that's better.
But do you suggest I should go to some domain of expert to which you feel is there into your medical science? For this problem, this is now old now. I am suffering from 5-6 months now.
So this first thing is the diagnosis again. If you have been adequately evaluated with probably a proper MRI scan or a CT scan as per the orthopedician's advice, then he has reached the decision to start you on steroid injections, that's fine.
I am interested now in knowing how to prepare ourselves for some unexpected health issues or some emergencies. What we can do, some strategies from your side.
So that's a very difficult question. None of us are getting any younger. And at some day, some disease or some organ will beckon us and let us know that I have a problem here in your body. So how you need to prepare yourself? You need to focus on what's important in your life, and what is the kind of treatment would you go for? This may not be very applicable to us, the ones sitting here, but patients who are terribly sick. Many of you may be caregivers to sicker patients, bedridden patients. Such caregivers need to decide what to do if my older patient or my parent or the older person I'm taking care of is suddenly advised hospitalization and ICU and possibly ventilator. Where do I draw the line? These are discussions you need to initiate. These decisions may be difficult to take individually because the person you're taking care of may not be able to express his or her needs. So you need to discuss with your siblings and say, this is a condition. What do we do when this happens? Because often such an emergency happens and there is hardly any time to think. The 90-year-old patient with dementia, with a cancer, who's already had a bone fracture and is being treated at home, is suddenly asked to be rushed to the hospital and is pushed into the ICU, and the doctors say, we have to ventilate him. You have to tell us now. So there's no time to decide or to think. So this is called advanced care planning. And this is where the parent, the family needs to sit together and decide what's the way forward. Because these decisions have to be taken before, not at the time. And preparing ourselves, you need to accept that we are all minute people in this big world. Disease can happen to us anytime. And the most important thing is to be healthy. Nothing else is more important.
Thank you so much, doctor, for giving such wonderful tips. You have explained very well how we should take care of our physical health and how we should take care of our cognitive health, brain health. But doctor, when it comes to emotional health, it becomes slightly difficult for all of us how to take care of our emotions. Any tips for that? Social angle. You said in your first answer only that loneliness is there, and then we need to connect with each other, but then we hesitate also in connections, like sometimes parents also, they don't want to talk to their children thinking that they are busy. So some tips from your side, how we can connect with each other in a better way.
So everybody has got certain qualities. There is a leader in every group. This leader sees that people meet up regularly in a place and they have events. I mentioned it earlier in one of the talks. All the society talks I've gone to. Find that person who hasn't come. Find out why he isn't coming. Maybe go to his house, establish a relationship, a rapport, and slowly draw him forward. The other day in my society where I live, I was walking with my 2-year-old daughter, and I find in one of the rooms there was an elder person who was singing, and a lot of elder people were sitting and clapping hands and enjoying. So I was drawn to it. I took my daughter and we went and sat there, and all the eyes turned and looked at us because we were the youngest in the group there. But I could say in that room where about 10, 15 people were seated, there are about 30, 40 more in other places. Why aren't they here? Why isn't the society bigger? So I am not there at my society all the time. I usually end up reaching only in the night. But on that day I was there. But what I've realized is many feel they don't belong. Right. So they feel they're not part of this. This is a different group. Very well experienced people there. Utilize them. This is the way to connect and connect. That's the only way forward.
Thank you so much. Thank you, Dr. Steve. And I will come to Viva. I would request you to conclude it because you are working in this direction. So how important your conversations are. You can just conclude with that line.
So
We always.
Yes,
three
doctor.
takeaways.
Sorry, go ahead.
No,
Go
just
ahead.
3 takeaways before I leave. I have to be somewhere else now. Three
Yes,
takeaway
doctor,
points I would
only
say.
1 minute, only one last minute. We are closing sharp 5:30. 1 minute is there. I will request Viva to give the comment on that part, connections. And
No,
doctor, you are free in a minute. Yes,
Yeah,
Viva.
so just
Dr.
quickly say
Steve, I don't.
3 takeaways I'd like to say. Maintain your physical health. Go for a walk, even if you can. Walk daily, whatever it takes. Don't worry about what people think. A lot of people think if I'm seen walking with a stick, it's a shame. It's a shame when you walk when you cannot walk or you need 10 people to carry you. It's not a shame walking with a stick or a cane. Two, maintain a good mental health. Avoid criticisms, avoid negative talks, avoid anything that brings your mind down. Three, forgive. Forgive people, forget, and try to be of use to somebody. You never know who needs your help. So if you are able to connect and share, you may be doing more to somebody, more for somebody else than you would have ever imagined. That person, that one word from you is enough to maybe lift his life altogether.
Yes, yes, yes. Very true. Thank you. Thank you, Dr. Steve, for your all the advices. Very nice, wonderful interaction with you.
All participants, we hope you had a great session. The key takeaways for me was that it's for a holistic, happy, healthy aging. You need a balanced living, which is physical health, cognitive health, mental health and emotional health, and I'm also going to add spiritual health here. And when you're doing all of these five together is when you're truly taking care of yourself. Dr. Steve is here for physical health, while Sukoon is here for emotional health and social health. And it's a great partnership between Apollo and Sukoon. Wish you all a very good evening, and we hope you have a very happy, healthy aging ahead. Thank you. Have a good evening.
Thank you. Thank you, Viva, for this opportunity. I wish everybody a very good day and many more wonderful years ahead. Thank you so much.
Thank you, sir.
Thank you, Dr. Viva and Anubha, for this wonderful session.
Thank you, all the participants.